Good evening, everyone, and welcome to this very special webinar. My name's Nicolette. I work with MSF Australia as a media advisor. I first joined MSF in 2001 and have worked in a number of countries, including Malawi, Ukraine, Ethiopia, and South Sudan. I begin today by acknowledging the traditional custodians of the lands on which we're joining from. For me, it's Bundjalung land, and I pay my respects to their elders past and present. I'd also like to acknowledge our guests from New Zealand. Kia ora. Thank you all for attending our webinar and for your ongoing support that makes our work possible. This webinar is dedicated to our patients and to our extraordinary colleagues working in Gaza and the West Bank. MSF has a team of over 1,000 people in Gaza supporting our medical activities, the majority of whom are Palestinian. They're not only working in the most challenging of conditions, but are living in conditions that are incredibly difficult, in overcrowded tents or in the rubble of buildings, with inadequate food supplies and without clean water. So many of them have lost loved ones or are separated from their families. They're traumatized and exhausted, and yet they keep turning up to work to provide medical care to their community. Behind me on the screen, you can see two whiteboards with the words, "Whoever stays until the end will tell the story. We did what we could. Remember us." Our colleague, Dr Mohammad Abu Mughaisib, wrote these words on the 20th of October 2023 on a whiteboard used to plan surgeries in Al Auda Hospital in northern Gaza. He was a 38-year-old doctor and father of three. He was killed by a strike on his hospital a month later while at a patient's bedside, along with MSF's Dr Ahmed Al Sahar and another doctor, Dr Ziad Al Tarari. Al Auda Hospital in total endured 3 bombardments and 2 sieges by Israeli forces. Being a health worker has been no protection in this war, despite international humanitarian law clearly stating that health and humanitarian workers, as well as civilians, must be protected. A total of 1,060 health workers have been killed since the beginning of the war, including 9 of our MSF colleagues. The healthcare system in Gaza has been systematically dismantled. Out of 36 hospitals, only 18 remain partially functional. In the northern part of the Strip, there's no health system anymore. Kamal Adwan Hospital has been razed, while Al Shifa, Al Auda, and Indonesian hospitals are seriously damaged and only partially functioning. After our teams were able to return to the north to assess the situation a few weeks ago, they were shocked to observe that in Indonesian hospital, every medical machine seemed to have been deliberately destroyed. They were smashed to pieces one by one to make sure that no medical care could be provided anymore. They told us how devastating it was to see the state of these hospitals. So the challenges facing our teams in Gaza are immense. MSF strongly denounces Israel's announcement in recent days to block aid into Gaza. Humanitarian aid should never be used as a tool of war. Regardless of negotiations between warring parties, people in Gaza still need an immediate and massive scale up of humanitarian supplies. A permanent ceasefire and military withdrawal are urgently needed to end 16 months of the most horrific suffering and to facilitate the end of the hostage crisis. We welcome the release of Israeli hostages and Palestinian prisoners who've been detained arbitrarily in Israel. The liberation of these people and their reunification with their families has been long overdue. But Gaza remains in a dire humanitarian crisis, where survival is a daily struggle for millions of people. It lies in ruins. The scale of destruction, death, and displacement is beyond comprehension. with hospitals, homes, and vital infrastructure severely damaged or destroyed. After 15 months of relentless bombing and devastation, any respite for the people of Gaza is welcome. But the physical and mental health consequences of this war will last for decades. I'd like to begin with a quick overview of how we'll spend the next hour together. This webinar will consist of two parts: a 20-minute conversation about the medical humanitarian situation in Gaza and how MSF teams are responding, followed by a 30-minute space for questions. Upon registering for the webinar, you would have had the opportunity to submit a question. So thank you to those who send those through. We've had such a diverse range of questions. It was really great. And we'll try to get to as many of these as we possibly can. Before I introduce you to our speakers tonight, I'd like to share a short recording we received from Shelley Harris Studdert, who's currently working with MSF in Gaza as a midwife activity manager. Shelley is from New Zealand and is based at Nasser Hospital in southern Gaza, where MSF teams are providing sexual and reproductive health services, including supporting women giving birth and providing neonatal intensive care.
At Nasser Hospital, there are between 200 and 250 babies born per week, so up to 1,000 babies per month. MSF's wraparound service works super efficiently and effectively. I've experienced several times where really vulnerable women have been identified and we can direct aid to them specifically. An example would be a woman who I met who had just had her baby 3 hours before. A beautiful, pink, healthy, chubby little girl. But the woman was just tears streaming down her face, because this baby was all that remained of her family. Her and her husband had left their family home, and during the bombing, the house was completely destroyed and all her family members killed. 4 of her children were in that building. This kind of trauma is not rare. There are so many people who have lost members of their family, if not multiple members of their families. It was really heartwarming to see what MSF, the care that we could provide this woman. The mental health team will provide ongoing care to her. She'll be able to get postnatal care at the PHCC clinics. And if there are any problems identified with nutrition or malnourishment, she'll be able to receive support from those places. MSF is making a difference in this context, and we're so grateful for the support of our donors, and you're really making a difference. I'm just so proud to work for MSF and to be here in Gaza. Thank you.
It's now my great pleasure to introduce our guests. Joining us from Gaza is Dr Mohammad Abu Mughaisib, and joining us from Sydney, Suzel Wiegert. I'd like to thank you both so much for taking time out of your busy days to be with us. Dr Mohammad Abu Mughaisib, or Abu Abed as he is known, is a Palestinian doctor who first joined MSF in 2001. He's helped lead MSF's medical activities in Palestine for more than 2 decades, as our teams have been providing specialized medical services for burns and trauma patients. Suzel is an emergency nurse based in Sydney. She spent 2 months in Gaza last year, working in the emergency department of a hospital in central Gaza. Suzel is about to return to Gaza to work as a nursing activity manager. So, Abu Abed, before the war started, you were helping to lead MSF's medical activities in Gaza. Can you tell us about what the focus of our work was briefly before the war?
So first of all, thank you for inviting me for this webinar, and it's an honor to really speak on behalf of MSF and present MSF activities in Gaza and my personal experience as well. So before the 7th of October, MSF was providing specialized care mainly for trauma and burn patients. And we were working closely with the main hospitals in Gaza, in central Gaza and south of Gaza. In addition, we were providing building capacity for human resources for medical staff who are working in the hospitals, increasing their capacity and development career. So the activity was really more specialized and more focusing on burn and trauma patients.
Mm. And I mean, Gaza has, we hear that you had 36 functional hospitals before the war, and there's only 18 that are partially functional now. But it was a very sophisticated health system before, wasn't it?
As you mentioned, I mean, first of all, I mean, before even we have to here just to clarify things that before even the 7th of October, the health system was a fragile health system. I mean, more than 17 years, this health system was suffering from the closure and the siege. So, for example, the drugs, the essential drugs and the medical disposables were around 50% zero stock before the 7th of October. There is difficulties of traveling for the health staff to get trainings to develop their careers. It was very difficult to cross and travel out of Gaza. So, and as you mentioned, I mean, now we had before 36 hospitals and now 18 partially working, and I doubt that 18 are partially working. To be honest, I mean, it's really more than 2 or 3 only who are really partially functioning, and the rest, I mean, it's just not functioning at all.
Yeah. How much did your work and your team's work change after October the 7th, 2023? Like, yeah.
I mean, there has been a lot of. I mean, it's a major change. I mean, this war, we didn't expect this kind of reaction or this type of war. I mean, Gaza has been all the time on this kind of military wave due to this conflict between the Israeli Palestinians. Every few years, there's a military wave for a few days, you know, there and there. But the war of Gaza this time, I mean, after 7th of October, was really massive. There was a huge destruction which affected every layer on Gaza. I mean, here the basic needs has been affected. Water supply have been destroyed. Electricity have been destroyed. Roads, schools, sewer system, buildings. I mean, the life totally changed. I mean, changed compared to before 7th of October or compared to other military waves. Let's call. I will not call the recent military waves as wars. No, this is a real war. For us, I mean, it was very challenging, very difficult because we never used to be forced to displace our places. I mean, the first weeks of this war, all Gaza City and North were forced to displace their homes and neighborhoods. And this has been something new that we were not used to it. The security, it was very difficult to move. I mean, with a vehicle or without vehicle, to reach the hospitals and to deliver services, it was very difficult for us. Knowing that the staff of, as you mentioned, the staff of MSF, the majority of them are Palestinians, so they are part of the population. So they were suffering and facing the same consequences of this war. So it was really, we tried to adapt as much as we can, knowing that it's very difficult was for us. All of us has been affected, moved from our homes, displaced, separated from our families, lost a lot of our families, friends, colleagues. And at the beginning of the first weeks of the war, we were not able to function properly. I mean, we were not able to deliver our services properly.
And MSF had to keep adapting, didn't it? And keep moving to different facilities depending on what was happening. So you had to be very flexible, I imagine, in terms of your planning.
I mean, MSF and the staff, we had really to evacuate several times. We evacuated more than 14 times MSF in general in Gaza because of this forced displacement from one hospital to another. We are displaced from, for example, in Gaza City, we were displaced from the hospitals of the north or the clinics of the north. Then we went to the middle area and we were forced to displace sometimes the hospitals in the middle area. Then we went to the south, and we were forced to displace the hospitals. And we went to the Rafah, the south of Gaza Strip, and we were forced to displace again. So the displacement and the evacuation, we had to move and to adapt. And every time we try to adapt and rebuild again, and we start from the beginning. And as well for the staff, the MSF staff, National South Palestinian, we were as well moving from with our families, evacuating, forced to be evacuate this neighborhood because it's under order evacuation, moving to another neighborhood. And so it's some of our staff, more than 9 to 10 times, we had to evacuate the places that they have moved to.
Yeah. Suzel, you when you worked in Gaza last year, you were working in Al-Aqsa Hospital, and you were working with the Ministry of Health. So it was a Ministry of Health run hospital, and you were there as additional support. Can you tell us about that experience? I mean, it was obviously at a time when there was many mass casualty events coming in. There was huge supply issues. So can you share a little bit about that experience?
Yeah, it was something I've never seen before. Also because in Al-Aqsa Hospital, there was a lot of displaced people on the ground of the hospital, and somewhere also in the emergency department. So we didn't have the bed available for the people who really needed, because there was so many people. It was so crowded, and it was also so busy because we had mass casualty practically every day. And it was very difficult because we didn't have the equipment that we needed. So it was very limited what we could do. And when we were doing, like saving a life by putting a chest drain, for example, in the resus room. So we were doing that knowing that this person will not have an ICU bed or intensive care bed after. So it was also a bit heartbreaking to know, you do the best you can do, but after that, it doesn't mean they are out of the woods. So in that regard, it was very difficult.
Yeah, and you've shared how supply, the access to medical supplies was an acute challenge. I mean, it was a challenge for MSF, but it sounded like the challenge for your Ministry of Health colleagues was profound.
Yeah, I think it was worse than the challenge for MSF. They had very, very limited supply. And in our research room, we were getting the equipment that was available, meaning it was not maybe the equipment that we needed. It was really, but yeah, it was critical. At one stage, we didn't have gloves, we didn't have gauze, we didn't have anything to clean the room. And the room was a 3-bed research room. And at time we had 7 people in it. So they were on the floor, they were everywhere.
Yeah. You've worked, Suzel, in many contexts for MSF in the past, in many war zones, including Syria, Iraq, Yemen. You've also been on a search and rescue boat in the Mediterranean for MSF, but your assignment in Gaza was uniquely different. Can you tell us why and how? Why was it so different?
Because everything was 10, 20, 100 times worse than everywhere else. Even in Yemen and Iraq was quite difficult, but it was nothing compared to Gaza. Gaza was really, it's hard to imagine the suffering there. And yeah, it's because everything was so much worse than what I've seen before. And also because we had a lot of NGO people, because there was strikes every day. So NGO people were coming, and we had a lot of children. And that was really heartbreaking. I've never looked after so many children. So, and usually they were all from the same family too. So when the survivor from the strike was coming, it was hard to watch too. And when they realized I've lost, 5, 6 family members in one go. So that was very difficult.
it's interesting, you know, when our colleagues who are very experienced and have worked in many places in the world, including our Palestinian colleagues who've obviously worked in really difficult conditions, they say that they've never experienced anything like this before. You know, the people, and I think it's because the degree of suffering, the seriousness of the wounds, the fact that we're, you know, it's a population who's completely trapped, who are being bombed relentlessly and can't leave. It makes the situation just unprecedented. And for an organization like MSF that's been doing this for 50 years, to say this is unprecedented, I think is really, it's incredibly, yeah, it's very sobering, I think, for all of us. Yeah. Um, Abu Abed, one of the obviously the one of the big shocks, I think, for us as an organization, and I think for all humanitarian and healthcare workers, is the fact that is that that hospitals have been targeted consistently in Gaza during this war. You know, we've experienced many attacks, as you said. Our teams have had to move, but the healthcare system and healthcare workers have been killed and injured in extraordinary numbers. So the rules of war are being violated. And I was just interested to kind of get your reflections around that.
I mean, this is that as I mean, I mentioned. I mean, this is and Suzel mentioned. I mean, this is something that you don't see in other countries at all. Countries with conflict. I mean, every layer in Gaza has been targeted. Among them, of course, as well as the hospitals. I mean, hospitals have been targeted directly, indirectly. And Israel knows very well that the hospitals are, I mean, not only medical doctors and the patients there. In Gaza, the hospitals has been used as well by the people, the population who were displaced. They were trying to find a safe place to shelter. And among the safe places were schools and health structures like hospitals. And unfortunately, they had these hospitals or health centers has been targeted several times. We were calling to avoid this, but nothing happened. Even, I mean, recently in the south or in the north, or what happened in Kamal Adwan, I think this really reflects that this is something that me personally, I never witnessed in all during my life. I'm working in this kind of context, and that health system has been targeted intentionally.
Yeah. Can you share, Abu Abed, with us a little bit about your own personal experience, you know, in terms of beyond being an MSF kind of senior leader, but just for you as a human, how this war has had an impact, because you've had to, you know, separate from your family, you've lost your home. Can you share some of that experience with us?
I mean, I'm used to work in this kind of emergency, but this time it was totally different. I mean, I knew since the 7th of October that something will happen. And of course, I mean, everyone, and me personally, I condemn what happened 7th of October, but I mean, the reaction, it was really massive. I mean, I never thought that I will leave my house, first of all, and just run away with few clothes and few documents, and to come back maybe after 1 week. That I didn't come back. It was impossible to come back. The separation was for me at the beginning. I was very happy that my family managed, and I'm among the luckiest people in Gaza that managed to get their family outside of Gaza. When I was on the Egyptian side, I mean, saying goodbye to them, it was very hard for me, but I was really smiling. And at one point, the Egyptian soldier was saying, "You are smiling, and you are very happy." I said, "Yeah, because my family will not die." That was, I mean, they will not die. They managed to cross, and they will not die. And I was really scared about them. I was really stressed about them. I saw them suffering at the beginning of the war, the first 6 months of the war. They were really starving. At one point, they felt hunger. When you feel hungry, your kids are feeling hungry because there was nothing to buy. when they were suffering to use the bathroom, when it was a project to have a shower. So I mean, all of this, it has been difficult for me. And of course, when you see what's going on in Gaza, I mean, the hospitals has been, I mean, shelters, people just sitting with families inside the hospital. When you see children, as Suzel mentioned, majority of the kids arriving in the emergency or kids are children, and with severe injuries, with severe burns, with severe, complex injuries, amputation of both lower limbs. And it's very, and sometimes they don't know that all the family, the parents has died and siblings have died, and the child of just 5 years, he doesn't know that he's the only person, only alive, and he's amputated. Imagine, this kind of, I mean, every day, every minute, there is really a very heartbreaking story in Gaza during this war. 24 hours over 7, the airstrike didn't stop at all. The drones didn't stop. The shelling didn't stop. You could be in the wrong place, in the wrong time, and you could be killed or injured from the collateral damage. So, I mean, we had colleagues, sorry, I just want to share this as well. We had colleagues working in MSF that they were working inside the operating room, operating on patients, and they received the news that they lost their kids in an airstrike. Their kids has died, or their families have been injured. So all this, we have colleagues that still under the rubble. We couldn't remove their bodies still. Their bodies are under the rubble with their families, and because of lack of equipment, we couldn't still remove them from there. So, I mean, in every corner, in every side, in every minute, there is a heartbreaking story that in Gaza that we can share.
Yeah. You wrote a really moving piece called "They Say That Life Has Returned to Gaza," and I was wondering if you could read that, please, for us before we maybe go to some questions, Abu Abed.
Okay.
Thank you.
So, I mean, as they say, life has returned to Gaza. What kind of life have they returned with? Have the dead returned to their families? Have the destroyed houses been rebuilt? Or is the rubble still a witness of the disaster? Have the bodies been removed from under the rubble? Or are some of them are still there, being eaten away by the days as they are eating away at us? Have the streets analyzed regained their features, or is devastation still inhabiting every corner? Have the wounds of the wounded healed and the losses of patients been compensated? Or has pain become their constant companion? Have the children returned to their schools and the students to their universities? Or their future still suspended between the tents and the rubble? Have you compensated for anything we lost, or have we lost everything for nothing? Enough falsing reality, enough selling illusions. Gaza is no longer alive, but it's struggling with the death every day.
Thank you. So we received about 70 questions from our supporters who signed up for this, which was amazing. And there was lots of common themes across the questions. So we're going to try and cover as many of these as we can. So I might start already, Suzel, with you. This was a question that we received just about the sort of logistics, really, of how, as an international kind of mobile staff member for MSF, how you would actually get into Gaza, and if there was any protection that was provided by the Israeli forces, in terms of coming in.
Okay, so from Sydney, so you fly to Amman. Then from Amman, we take a bus, which takes us to the border between Jordan and Israel. And there is a first border, if you like, that we have to go. Then you go a few hundred meters, and there is an Israeli border on this side. Then after that, it's another bus, and there we cross the part of the West Bank and all this part of Israel, and we get to Kerem Shalom, which is a crossing at the south of Gaza. There in Kerem Shalom, usually there is a UN armored vehicle that we're waiting for the IMS coming in.
Mm.
Then from Kerem Shalom to, I was in Dar al-Bala, which is in the middle area. It's depend. It's usually about 45 minutes, but it can take up to 4 hours because there is different controls and if the security from the convoy thinks there is a danger, it will stop the convoys and we'll wait. So if we were protected in a way, I think we were, because Israeli force, the Kogat, who is organizing all the transfer, knew about us. But like Abu Abed said, I was very conscious of the danger. Like, you know, a lost bullet was not something that was a remote possibility. It was very real.
Mm. Yeah.
So I think in a way, compared to the Palestinian civilian, yes, we had a little bit more protection, but there was also this fear, you know, of the, like Abu Abed say, wrong time, wrong place.
Mm. Mm. How are you feeling about returning? You're going to be going back in about 10 days.
I'm quite happy to return, actually. I think I'm returning in the same position that I was. And so there is few changes in Al-Aqsa, so it will be very interesting to see what's happening there. And it will be really nice to see the, you know, local colleagues that are there and still in contact. And so I'm really looking forward. I think it would be even maybe scary compared to the first time. The first time I knew what I was going into. This time with the ceasefire, and no one knows exactly what's going on. So, but yeah.
Yes, so there's we did have quite a lot of questions, obviously, about the ceasefire. And Abu Abed, what's, you know, the hopes for people inside Gaza around the ceasefire? Do people hope that it will hold? Does it feel very precarious? What is the feeling?
I mean, the people were, I mean, looking, of course, looking forward that this ceasefire will end, will sustain and will continue as an end of this war. But from the news that they are hearing, they are really very stressed. I mean, when you see that it will break, it will not break, it will follow. So the people are really stressed. And they, I mean, we knew that, and I said it, that, I mean, fear has gone with the ceasefire, at least fear. There is no airstrikes there, there's no bombing. But pain, I mean, started because the population, when they went back to their places, they found only rubble. They didn't find their homes. I mean, and they are struggling to resettle, and knowing that there is ongoing still threat about continuing the war in the last few days from the Israeli side. So people are really stressed, but at one point, I mean, this time they took their decision. This is what, when you speak to them, so to several people and colleagues, that they want to stay this time. They are not planning to move as before, and they will not listen to any evacuation order. Then they prefer to die in their close to their homes or neighborhoods.
Yes, because we had quite a number of questions about, you know, the Trump proposal to you know, permanently relocate Palestinians from the Strip. So what? Yeah, the response to that has been mixed, or what are people saying?
I mean, the first response was what happened when the population were allowed to move back to the north. You saw there is now more than 1 million people moved to the north. And this is, I think, the answer to Trump. This is the answer of evacuating them or asking them to evacuate Gaza. So they went, and this is, I think, the clear answer. And when you speak to them, they say that we are not moving. Majority of them, even if they lost their homes, lost everything, but they don't want to move. I mean, it's difficult to move and to evacuate, and they are attached to the land, and they are attached to their still lost memories. So I think it will be, this is the answer to the Trump proposal.
Yeah, yeah. Suzel, one of the questions that we had was, how hard is it to walk the fine line between providing care and taking sides in such a political conflict? I mean, of course, that's MSF. We are an impartial and neutral organization, but yeah, how hard is that sometimes?
I think we are trained with MSF not to take sides. There was other context where we have been looking after people from both sides. In Gaza, I've never been looking after Israeli, but I think for us, they are patient. They are not Israeli or Palestinian. They are just patient. So it's hard sometimes because it's not about the civilian. It's really about the government doing whatever they want to do and don't know their agenda exactly. And the civilian people are just in the middle. But it's the same for the Israeli who have hostages they haven't seen for 500 days, or it's the same for them. It's very difficult. So we see the human being. You don't see the politic behind it. And as I say, in Iraq, we were looking after the civilian, but we had some ISIS fighter coming in the hospital too, and we were looking after them the same. So it's very much the politics on one side and all the humanitarian things that we do, next to it.
It can be very difficult in this context when it's so incredibly polarized and politicized.
It's very,
yeah. Thinking about the medical act, it has to be impartial, doesn't it? How has Abu Abed, how are the mental health needs of the communities being responded to? That we had quite a few questions around supporting people's mental health needs.
I mean, with this ongoing war with more than 500 days, which is a different war, as I mentioned, that affected everything in the life of the population. I mean, the mental health needs are huge. I mean, I even sometimes discuss it with the mental health experts, and I said we need to find a new term in mental health for Gaza. I mean, a new term that has to be created only for Gaza, because the mental health team, the mental health status, it's a mixed, all what you learned in mental health pathologies, anxiety, insomnia, depression, panic. All of this are mixed in one at once for individuals, and we saw cases like this from depression, from stress, together with insomnia. So all of this, I think the mental health is a huge need, and we need experts to support as well the mental health needs in Gaza, because even before 7 October, mental health was needed to be developed in the community. So I think that it will need long-term rehabilitation of the mental health status of the population.
And of course, the uncertainty right now is really exacerbating that, isn't it? The not knowing, the fear that the bombs will start again. There was a piece that was shared by a psychologist who was talking about, for the children in particular, how incredibly difficult that uncertainty is. Suzel, what about, how do you see MSF staff from your observations? How do you see them coping with the trauma that they're experiencing and that they're observing, and how they manage to keep going, not just sort of physically but psychologically?
There is quite a good support when you are with the other MSF staff. After dinner, for example, there is always, we talk and we play games and, you know, things like that. So because everybody is a bit in the same boat, it's easier to talk. Then I've seen, I haven't seen, but I've heard of some colleagues where it was just too much. So they cut their mission, and that's fair enough too. You know, it's just, I know for myself, when I came back from Gaza, I was thinking a lot about, you know, about the colleagues, and then it went down quite well after that.
Mm. Yeah.
But yeah, I think you have to know your limit and to know when you are not doing too well and just seek some help. And there is some help, you know. I mean, with MSF, we have access to some counseling if we want. But as I said, talking with your colleague, it's the best thing for me.
Yeah, definitely. Yes, that shared experience.
Yeah.
Abu Abed, has the shackling of UNRWA, the fact that, you know, Israel has said that they are basically not going to be working with UNRWA in the future, how is that playing out currently in Gaza and the West Bank? Is it having an impact yet?
Not yet. It didn't have an impact, but if really it will happen, this will have a really severe impact on the health system, on not even the health system, the social life, because, you know, UNRWA is the main provider for health after the Ministry of Health, and it's the main provider for social hardship cases in Gaza, because, you know, Gaza has 60% of the population are refugees before the war, and now it's 100% are refugees. So they are the main providers for social support, for education as well. They are a main element in the education in schools. So if it happens, it will have really a severe impact on whole aspects of life in Gaza.
This week, you know, the news came that that Israel is not going to be allowing any more humanitarian aid in. They're trying to extend the first phase of the ceasefire rather than move to the second phase. And I was wondering, how has that affected life in Gaza now, and for MSF, what does that mean for us in terms of access to the supplies that we need?
First of all, using humanitarian aid as a tool in this war is really very bad. I mean, sorry to say, but I mean, first of all, we saw the prices started to increase in Gaza from the first day that they announced that they decided that they are stopping any aids to enter to Gaza. People were really running to the market buying, because they know what happened before. They starved, they had the starvation, they were not able to find, so they started to buy and stock things for MSF. We have been suffering since long time, and we had supplies that took longer to bring. With the ceasefire, we were able to really to bring a lot of trucks, but still, I mean, this is not enough. I mean, we call for sustaining this supply chain. We have trucks now waiting in the Egyptian and Jordanian sides, and you know, these drugs, especially in the Egyptian side, are exposed to weather and could have it could affect the efficiency of the medication there. So we are calling not to stop, because this will affect the programs. They will affect the hospitals in Gaza.
And also, we've had a lot of challenges, haven't we, in terms of getting the supplies that we need in. There's this challenge around what they call dual use of supplies. Can you explain what that actually means, and how that has an impact in terms of us being able to get access to the things that we need?
So of course, the news issue was since long time. I mean, since the beginning of the war, we have this restriction from the Israeli side. But of course, when these items include water pipes, I mean, that are used to maintain and to deliver water. We have some biomedical machines that are used for the pediatric services for our hospital. So there is items that are considered dual, but they are very critical and needed to run the water sanitation programs that we are running in Gaza, as well to able to provide medical care for pediatric services and surgical services.
Hmm. A lot of the people who were sending in questions were interested to know what MSF's plans are now with the ceasefire, how we're changing our activities, what we hope to do. So we are running a number of field hospitals and mobile clinics, but yeah, can you explain how we're sort of trying to expand and adapt our plans now?
I mean, MSF, since the ceasefire, we were discussing this, I mean, and doing assessment in Gaza to know where is the needs. So the needs actually, where is the population moved? Because as I mentioned, 1 million of the population who were in the south and the middle, they moved back to the north. And the north, I mean, so we moved part of our activities as well to the north, where the population have moved. In the north, there is a huge need in north of Gaza after the huge destruction of hospitals and no remaining hospitals there. So we decided to shift part of our activities to open a field hospital for pediatric in the north to provide pediatric services there. We have a surgical activity as well in the north that we will try to shift part of it to the north to be able to provide their surgical activities, in addition to other clinics in Gaza and the north, because there is really the needs now. There is the destruction. There is no health services. And I think this is what we are going to continue and to monitor.
So there has just been an Arab leaders summit in Egypt where they are talking about a plan to help rebuild Gaza that would cost something like $53 billion. The many people who are watching tonight are interested in how Gaza can be rebuilt. You know, what would be involved in from an infrastructure point of view and trying to sort of rebuild hospitals. I mean, obviously at this stage, nothing can be planned until there's it's clear that that the ceasefire is actually going to hold. But what oh we've obviously lost light there, Abu Mughaisib, but we can still see you in the shadows. What's your thoughts about the rebuilding of Gaza, and particularly, you know, because so many of the hospitals are being destroyed, this is going to be a huge undertaking, isn't it?
Sorry for the light, but this is something new in the normal in Gaza. We have the cut, even with the generators and myself. But sorry, I mean, when you say how they will start, as I mentioned, everything has been destroyed. It's not the hospital. So you streets, yes. Electricity, yes. Sewer system, yes. Water supplies, yes. Schools, yes. Everything is destroyed. I mean, everything is really literally destroyed. I'm not here telling that partially, but really there are some neighborhoods have been, I mean, removed from the map. So it will be a really huge challenging. Removing the rubbles is a big challenge. Removing the rubbles, that really is, according to the UN, 170 billion tons of rubbles in Gaza need to be. It's a project itself. It's removing the waste in the streets in Gaza. It's a project as well. So I mean, it's a really challenging proposal and project by the plan by the Arab summit, and I hope that they could do it. I don't know how, but it will be really challenging. But this cannot be done without stopping this war.
Yeah, yeah. Suzel, one of the questions that we got was, what would you like to see Australian health organizations and professionals do to alleviate the pain and suffering in Gaza? Do you have any thoughts around that you'd like to share?
Just sending people, you know, like the expats going there, even if it's what we do is a bit limited, I would say. When I was there, it was very limited what I could do. But there is a lot of other things that you can do, and it's more on the personal communication with the patient or even with the displaced people who are in the hospital. And I think that they are very resilient. And I think to have people, to see that other people do care for them, I think it gives them a little bit of hope. And because for the healthcare, there is a lot of NGO, there is MSF, there is a Red Cross, there is a lot of them. But again, it's such big work to do. There is so much to do. So yeah, it's maybe thinking about, like you were saying, it will have consequence for years to come. And I remember one day walking in the Al-Aqsa hospital, and there was this young man, I don't know, he must have been in his 30s, with no arm and no legs. And I was thinking, you know, yes, his life is completely destroyed already. And you got so many young kids too who are being amputated. For them, it's life-changing, really. So maybe thinking about if there is a peace, if the war stopped, there will be a lot of things to do to try to look after all those people that have survived but are not in a good condition either.
Yeah. I mean, we definitely received some questions from people who were, asking about how, what can I do practically? How can I join MSF and go and help? And obviously, to work in a context like this, we only send people who are very experienced, who've worked in kind of these kinds of conflicts before. But definitely, for anyone who is interested to think about helping and working with us in the future, we just encourage you to go to our webpage and to look at the kind of profiles that we're trying to recruit for at the moment. Suzel, you told me when we were chatting beforehand that you applied 3 times to MSF before you got accepted. So you've got to be really determined sometimes if you want to work with us.
Yeah.
But we would definitely encourage that. Abu Abed, one of the questions that we were asked was that, for people who are in Australia and New Zealand and are watching this, many people feel helpless. They feel helpless to know what they can do and how to affect change, and they were asking what can we do to make a difference. What are your thoughts around that?
Yeah, I mean, I have several things. I mean, they have several things that really can support MSF or support Gaza, let's say. I mean, as you said, I mean, they can really join MSF. As you said, I mean, I mean, MSF is not only for medical stuff. I mean, MSF has a logistic team, has a, IT people. I mean, it's not only medical or doctors, surgeons, nurses can just work with MSF or support MSF. No, everyone can really work different profiles. Second, I mean, they need to advocate about this, raise awareness about what's going on in the context of Gaza and how MSF is reacting. When you are in the field, I mean, like Suzel, she was in Gaza and she will come to Gaza. I mean, it is different than when you are inside in the field and you watch it from the screen or you read it. So of course I encourage them to as well to really what they can donate, support, join, raise awareness. Everything is helpful from them, and we need them really to support us in Australia and New Zealand. And we need them to support MSF. The Palestinians in Gaza are really in need of this kind of support.
We have an election, a federal election coming up in Australia shortly, and actually MSF Australia, we're doing something that we did once before, but we're actually running a campaign called Vote for Humanity. And really, for us, we're saying that we would really be encouraging people to think about voting, according to their values, and to vote for humanity, to vote for sort of ethical behavior, to for accountability around holding parties accountable for international humanitarian law and safeguarding the Geneva Conventions, investing in humanitarian policies to ensure global altruism. These are the really, we really want to sort of try and encourage our supporters to think about, yeah, voting for humane policies when they go to the ballot box. Um, we did have a question around the West Bank, Abu Abed, and you're the deputy medical coordinator for Palestine, so you also have a perspective on and responsibility around what we're doing there. It doesn't get reported on a lot, but if you could maybe just briefly tell us about what's been happening there and what we're trying to do to support the communities in the West Bank.
I mean, we are there in the West Bank since a long time as well, providing mainly mental health activity, women health activity. And now with the war in Gaza, I mean, everyone was focusing on Gaza. But during the ceasefire, things more are really getting worse in West Bank, in the refugee camps mainly of the West Bank there. There has been as well displacement, exactly the same scenario that happened in Gaza, but in a different version in West Bank, that people are forced to leave their homes. There has demolishing of the infrastructure as well of this refugee camps. There is no access for medical care anymore. There is no access for everything. So of course, as usual, myself, we are there. We try to respond to this huge needs to increase our capacity in delivering medical care through mobile teams in the West Bank, and trying to work mainly with the emergency departments of the main hospitals of the West Bank. So we are not forgetting West Bank. The needs as well are increasing there. The situation is becoming really tense there. And we want as well to look on the West Bank as we looked on Gaza.
Yeah, thank you. Yes, it has been a challenge to sort of really get attention, I think, on it. But yeah, thank you. Okay, so Dr. Abu Abed and Suzel, our time is nearly up. But thank you so much to you both. You've really left us with so much to think about. I'm really very grateful to you both.
Thank you,
Thank
Nicolette.
you.
Thank you.
Thank you.
Thank you.
And thank you to our audience. Thank you for taking the time to be here tonight. We appreciate and value your support and solidarity. MSF can't do this alone. We rely on individuals like you rather than governments for our funding. Our financial independence in times like these is even more critically important. If you'd like to support our work in Gaza and other emergency contexts around the world through a donation, there's a QR code on the screen, or you can use the link you'll be receiving along with the recording. Thank you again, and good night.